First of all, I would like to thank the Magnus Group for giving me an opportunity to share my findings across these prestigious delegates. I'm from IIT Bombay, a research scholar and also a faculty at BMS College of Engineering, Bangalore, India. Uh, Before I begin, I would like to thank my team. Sorry, my professor, Venkatesh at IIT Bombay, belongs to Department of Chemical Engineering. So we belong to Systems Biology and Metabolic Engineering Laboratory. And also thank uh, the Metplex team for giving all the technical supports, who are pioneers in the field of type 2 diabetes and who have a lot of platforms to personalize the the drug dosages for different the medicines. Uh, to begin with, uh, so we know that where are the various we have the nutraceuticals which can definitely help the diabetic patients in controlling the glucose level. And a lot of the random clinical trials are happening across the globe. Various institutes, prestigious institutes, they have conducted the RCTs, random control trials, on humans specifically, and they have published very interesting results. So I have put an effort here just to collect their findings and consolidate and see how are they useful to the humans. Can we have in a consolidated in a page, and can we see their effect, and can we think beyond what is already discussed in their findings, in their discussions, in their publications. I mean, so we know that the well-known drug, the medicine to treat the diabetes is for type 2 diabetes, metformin. Very, the very first line drug to treat a biogonide drug, which can control, in various, the mode of actions. So exactly in a similar way, we do have the various, the natural foods. So what happens if we consume on daily basis? Can we consume them on systematical and daily basis to control our diabetes without taking or with taking the traditional drugs? So keeping that in mind, so we know what is type 2 diabetes. So it's a dysregulation of the blood glucose in humans, right? Because of the hormonal imbalance. So homeostasis is not maintained here. So what basically happens here is pancreas can't make enough insulin. So because of that, the muscle cells, they are not able to uptake the glucose which is there in the blood. And also the stomach plays a very important role here because it empties the glucose very faster to the blood, so that there will be a rise in blood glucose. And also the liver also puts a lot of the glucose into the blood through gluconeogenesis. It breaks the glycogen and keeps on pumping the glucose into the blood. These are the predominant the reasons why the diabetic individual will have the uh, uh, more glucose in their blood. There are other factors too. So I have done a exhaustive literature search, keeping this methodology. Our inclusion criteria were here. So the participants, so we were completely clear that we wanted to see the effect of those natural foods. Here, nutraceuticals, I'm specifically emphasizing on natural foods. There should be humans above 18 years of age, and the participant should not have any comorbidities, because there are other RCTs with other comorbidities as well. But here we are focused only on type 2 diabetes. Okay, the participant should have only type 2 diabetes, should be adults, and should not be if female, should not be nursing. So all those criteria we have included, and interventions should be measurable, right? Known quantity. We would like to know how much is given. If it is in liquid, what is the concentration? Solid, what was the how many grams? So we wanted that clarity. So there are studies where we had some confusions. In fact, we wrote to the authors and we could not get the responses, but we are not considered those the trials. And outcomes, so we have focused on fasting blood glucose, also the lipid profile as well, and also some of the markers also we have tried capturing wherever it was available in the papers. And the types of studies, we have included both the RDP, RC, crossover and parallel, all possible random control trials we try to include in our studies. And we have followed the same search strategy how others are following for Prisma. And we have manually, extracted the data and all the anthropometric, biochemical, physiological parameters we have extracted, right? Seeing even the BMI, WC, are there any effect on these interventions? And also we have calculated here the mean rate of reduction of all these parameters, FBG, HbA1c, our lipid profile, TC, LDL, HDL, TD, all those, and also the OMIR. So we tried calculating the mean rate of reduction of that particular parameter. Parameter here, I'm saying those FBG, HbA1c, all those things. So we could get finally, the so many papers here. After following all the criteria, started with 18,000 papers. So we could get 153 final papers for FBG. So fasting blood glucose, we could get 137 papers, all following all these criteria. So when we calculated the mean rate of reductions, so we have almost 29 interventions of natural foods. So starting from aloe vera, we have the Indian bell, the saffron, ginger, right, ginseng, we have garlic. So all these people have used in their studies, in their random controlled trials, and they tried, observing what is the effect on type 2 diabetic individual. Is it controlling, or how much it is controlling? Okay. So here we can see on y-axis the mean rate of reduction of fasting blood glucose. So it's in mg per deciliter per gram per day. I have normalized because each paper is having different dosages. Mg, they have so many durations. Some people have done for 4 weeks, some people have done for 12 weeks. So I wanted to see the absolute the reduction per day per gram of dose. Dose means intervention here, right? So suppose here aloe vera. So what is the amount of aloe vera given for an individual? So many grams. Okay. Here it says here per gram per day. So you can see the effect here. This is the range, minimum and maximum reduction of FBGs. Anywhere between 1 to 10. It's on log scale. 1 to 10 mg per deciliter of reduction of fasting blood glucose. It's very interesting, and I have placed here based on the p values, significant to the least significant. Okay. So these, have shown very significant reduction in their fasting blood glucose, these interventions. Okay. The aloe vera, cinnamon, ginger, saffron, all these things. Okay. Then, so further, so we tried, also, seeing the reduction of one of the lipid profile marker. This is TG. Okay. Here also the saffron and the calculations were similar. Okay. Saffron and, the bitter melon, the berberine, cinnamon, they have also shown very good, the reduction in TG, total, the triglycerides. Okay. So then we were wondering, so what might be the reason why the reduction? So these are all natural foods we eat on day-to-day life, right? So how do they, benefit the individuals? So through literature, we found that, so these are the reasons why they are, beneficial to the type 2 diabetics. So they are resembling our, the regular prescribed, the anti-diabetic drugs. Okay. They are also good at, controlling the hepatic glucose production. That's very, one of the important reason why people have more amount of glucose, right? So they are also very good in reducing that. So ginger is one example I given here, right? The saffron, again, it's also very good. So it's again very good, the antioxidant defense system. It increases that. Okay, the saffron. Similarly, we have almond, right? So it sensitizes the penicillin to secrete more and more insulin, right? So that the glucose uptake is more, right? So there are other the mechanisms as well here, right? So this is how they are beneficial. So this is again I've summarized through literature. So for everything I have the papers. Then we looked for a model, mathematical model. So I had a lot of data. So data is accumulated from 153 random clinical trials, controlled trials. So I wanted to just integrate that data into this model and see the effect. Okay. And it's a multi-compartment model. So we know 4 compartments, major compartments of our diabetic system: the pancreas, the stomach, the liver, all those. Similarly, here also, I found a paper, very interesting model developed by Dalla, the professor at University of Padova, Italy. So very interesting multi-compartment model, which can accommodate all our interesting components in this model. It's a mathematical model developed based on various ordinary differential equations for all these components. Okay. So we have understood this model, we have benchmarked, we understood how this model moves from healthy to diabetic, and how we can control diabetic to how we can bring down diabetic individual to the healthy mathematically through ordinary differential equations using the various rate parameters. So we have just, the very interesting and significant the interventions were, further studied. So the almond showed very good, the reduction in the fasting blood glucose when I calculated the mean rate of reduction. Okay. So then I looked for OGTT data. It's a very common test to diagnose. So how our body processes the glucose. OGTT is known, right? We give known amount and for a period of time, 120 minutes or 180 minutes, for every say 60 or 30 minutes, we draw the blood and see the amount of glucose our body is processing, how fast or how slow it is, right? So this is usually the pattern. So this is without the almond, okay? When the individual is given the almond, look at the pattern, it reduced, right? So they almost became, the healthy, right? So here, this is the amount of reduction of the because of almond intervention, you can see the area under the curve reduction 15%, okay, in comparison to the control. And also the 1 hour, the reduction is 23% and 2 hour reduction is by 15%. So very significant reduction, just the almond, okay. Similarly, another significant, the intervention was ginger. So when we integrated into the model, again, shown very good, the reduction. So whatever the data was available in the literature, I tried fitting into the model, mathematical model, and just try to figure out what could be the possible mode of action. Okay, why it is controlling. So I wanted to link the mode of action of these the natural food supplements. This is also given comparatively very good reduction. So when I looked at the parameters associated with the endogenous, with the those interventions, so the endogenous glucose production and the hepatic insulin secretion, they play a very important role in glucose control. So when I fit the data from the literature to the model, so I could link these two, the parameters which are concerned to the EGP and insulin secretion. So they played a very important role in controlling the type 2 diabetes. So we say our model predicts and it says that if you consume those, yes, they are also exactly similar like how our metformin works. Our metformin also try to control the EGP, try to control the, enhance the insulin secretion and control the uptake of glucose from the stomach, right? So these have also shown in a similar way. Then I tried because I wanted to check whether my model is compatible with my metformin as well. Then took a model, one more model for metformin, again multi-compartment model developed by Sun et al. In 2011. Integrated the diabetic model developed by Dallaman and another model developed by Sun et al. In 2011 for metformin, integrated and see the effect of metformin. So the PKs, we could able to reproduce PK, pharmacokinetics of metformin, validated with the experimental. Then we can see the effect. This is without metformin, blue line. This is with metformin. You can see how much is, reduced, right? So there's a huge reduction in blood glucose level due to the intervention of metformin here. So what I want to say here from that slide is our model is able to predict even metformin as well, as expected from the literature. Then we tried creating virtually the diabetic populations. Virtually we created some 1,000 population, diabetic population of varied fasting blood glucose from 120 to 180 mg per deciliter. Virtually we created, sorry, it's in a hurry to conclude. Yeah, right. So these are the, the diabetic individuals. When the metformin, these are the, untreated ones, blue lines without metformin. When we introduced the metformin, they shifted towards the healthy. So you can see here FBG, so 80 to 100, 100 to 120, shifted from 160, 120 to 180, it became 80 to 140 maximum. So metformin effect, we could able to reproduce. So what I want to conclude here is, to the best of our knowledge, so the very first of its kind, so we have tried accumulating all the possible random control trials data, on these natural foods, how are they beneficial. So we tried integrating to the model and see we tried predicting the mode of actions, how are they, controlling the fasting blood glucose. And also, we have tried fitting the OGTT and predicted the functions, and very similar to the metformin. And in future, so what we are trying to aim is like, we know the metformin. So can we use these natural foods as an add-on therapy in addition to the metformin, so that we can reduce the dosage of metformin, because we know even any medicine will have the side effects to some extent. So can we reduce? So that's what our intention in future. So thank you for your attention.